Mike Carberry, and I want to talk to you about regenerative medicine. So regenerative medicine is one of the biggest things to hit healthcare in my lifetime. There's so many different possibilities with this therapy. So regenerative medicine, if you're not really sure what that is, it's the use of stem cells or tissue that has stem cells typically in it to help your body regenerate. And there's various sources of the stem cells that you can get to do this. So I want to talk about this for a little bit because the best way to describe the regenerative medicine environment in the United States is it's a Wild West. It's a Wild West. There's people claiming that their product is the only product that works. Like there's a clinic in Denver, he's a medical doctor who says anybody who's not doing his program is ripping people off, and he publishes things to get people all fired up about if they went and got stem cells, even if they got better. We have people come back saying, I'm better, but this guy said you ripped me off. And here people don't know that that doctor actually lost his license for being non-compliant with the FDA and was doing things illegally in the United States and charges somewhere between $10,000 and $20,000 for his services. So usually when they hear that, they're like, oh, okay. So there's a lot of that going on in the United States. I just want to kind of touch base on what is fact, what is reality, and what is myth, and then what is gray, because there's a lot of gray in this. So the idea of stem cells, the first study I've ever seen on stem cells was, first of all, the first time the term was used was in about the 1870s. And the stem means things stem from it. So I guess they use plant analogies in embryological development. When I went to school and I was studying embryology, they talked about limb buds. And I remember somebody in the class raising a hand and saying to the professor, what's a limb bud? And they said, well, that's what your limbs grow from, meaning your arms and your legs. So stem cells are cells that other tissues stem from, meaning when your body is developing, let me put it this way. When you're first conceived, a cell from your mom, a cell from your dad join, and they start to multiply. And in about 5 days, you have roughly about 500 cells, and that is primarily stem cells. Those cells will evolve into other tissue. The way stem cells work is they basically are morphing into the tissue that is needed for that particular part of the body at that particular time. So they pay attention to things like chemical transmitters that signal growth or damage that needs repair and growth. So cytokines is an example of this, or inflammatory enzymes. The way your cells work, when you have a cell, it's got a lot of things in it. One of the things it usually has in it is a histamine type chemical. And if that cell becomes damaged and ruptures, that histamine is released into the intracellular spaces or intracellular spaces, and that triggers an inflammatory response. So histamine is actually a naturally occurring way to increase blood flow to an area to repair damage. And the idea is to increase blood flow to bring in tissues like white blood cells and stem cells to repair the damage. And so these stem cells zero in on things like cytokines, histamines, inflammatory triggers, and damage chemical transmitters. So they go into the area and they start to repair. They can morph into other tissue. So a stem cell it has two potentials. It has potential to proliferate, and it has the potential to differentiate. So proliferate means it can change into another stem cell. Differentiate means it can change into any other type of cell. And there's a lot of technical terms that at different steps along the way, you can say it's partially differentiated already, and it only has the ability to turn into certain tissues. But the idea is this: you have these cells, these tissues that can change into almost any tissue, and therefore repair or grow new tissue. So the first study I've ever read about stem cells, and I wasn't there when they wrote it, and I didn't read it when it was first published, but it was from 1913, and it was published in JAMA, and it was Dr. Maximilian Stern, who reported that he was using amniotic tissue on burn victims, on their skin, and the tissue was growing back, and in some cases even better than it was before they had to burn, which was, everybody was amazed by this. The amniotic tissue, the placental tissue, it's not new that it was being used. I mean, there's cultures that have used it through history. It was actually considered sacred tissue. So basically, there's different sources of stem cells. So let's talk about that. You have stem cells in your body. So you can get them from adipose tissue, which is fat, or you can get them from bone marrow. That's where your body is heavily laden in stem cells. The older you get, the less you have. So for example, when you're born, it's estimated that every 1 in 2 or in 10,000 cells in your body is a stem cell. When you're about 65 or 70, it's estimated that 1 in every 2 million cells is a stem cell. So there's less of them. And then as far as the ability to proliferate, when they test stem cells from infants or amniotic tissue or cord blood, or those cells have the ability, because they're young, to proliferate to infinity, meaning they haven't been able to exhaust that process. They can get them to reproduce and reproduce and reproduce. However, when they test stem cells of patients that are in their 50s and 60s, there's a limit to how many times those cells will proliferate. Doesn't mean they're not going to do their job. It just doesn't mean, I mean, think about it. If you're a baby this big and you have to grow into a 6-foot person, you need a lot of stem cells to do that. When you're a 6-foot person and you're not growing so much anymore and you're really just maintaining, you don't really need as much. And what happens to us as we get older, we have less stem cells and they are less viable, less ability to proliferate. That doesn't mean they don't work. It just means there's less ability. So getting stem cells from the patient's body is a source. You can get them from those two areas, fat and from bone marrow. But there is a difference if you get that stem cell from a 21-year-old professional baseball player, or if you get those cells from a 70-year-old patient who has chronic degenerative knee problems or back problems. Will it work? Yes, it can work. So the number of stem cells is important. So in getting stem cells from this source, there's 2 ways to do it. You can extract fat tissue, which involves a little bit of liposuction, and then you have to separate the fat tissue and the stem cells. And that involves centrifuges, and it can also involve using solvents to separate the tissue. If you get it from bone marrow, that means you have to extract, you have to drill in or use what's called a trocar to puncture the bone and get into the bone marrow and extract the bone marrow tissue. And then you spin it down and you do whatever you have to do to get the cells isolated, and then you inject them back into the body. And there are techniques that are being done all over the country and all over the world. In other countries, what they found is if you get stem cells from older people, it's better to cultivate those cells, meaning to grow them in an environment like a lab environment, and then put them back into the patient later, at a later date, so you have more stem cells to put back in. In this country, because of, there's concerns about who's patrolling the environment, who's keeping that environment pure. So in this country, the FDA has deemed that cultivating cells is illegal. Whatever you take out of the patient's body has to go in that patient's body before they leave. That's the way it was explained to me. You can't have them come back later and put the cells back in because you grew them for 8 weeks or 12 weeks. That is against the law in the United States. So it dramatically decreases the effectiveness of those 2 sources of stem cells. However, they're still viable, just less viable than younger cells. So there are people that fly to other countries, but this process of doing this is usually very expensive. I've heard people paying $20,000 to $30,000 to $40,000 to have this process done. But it does work. There are lots of people who had it done and it worked incredibly well. There's other sources of stem cells as well. So when you look at other sources of stem cells, you can get them from, let's say, amniotic tissue or placental tissue, and I'll talk about that in a minute, or you can get them from the cord or the cord blood. So the big concern with this is people say, well, all right, so these are from another person's body. Doesn't it have a different DNA? Couldn't that cause a problem? So here's what makes these stem cells so unique. When a mom is pregnant with a baby, that's 2 different DNAs. And the baby is inside the mom's body. And the normal reaction, if you have a foreign protein in your body, is to expel it or get rid of it. It's kind of like if you got a splinter in your finger, your body would send lots of white blood cells there, and they would attack that splinter over and over again and die off, and that would become pus, and that pus would create a pressure inside the tissue, which would start to push that piece of wood right back out of the body. Pretty amazing. So why doesn't the mom do this with the baby? Well, there's a zone, a barrier of immune-privileged tissue, and this is the placenta, particularly the amniotic side of the placenta, and this is also the cord and the cord blood and the Wharton's jelly that's in the cord, and then also the baby. For the first 2 trimesters, the baby itself is actually immune privileged. But in the last trimester, the fetus itself is no longer immune privileged. But the cord blood, and the amniotic tissue is still immune privileged. Now, there's 2 sides to a placenta. There's a side towards the baby, which is the amnion, and there's a side towards the mom, which is the chorion. And this placenta is a very blood-rich tissue. Basically, it's like an organ that transfers nutrients and oxygen to the baby and carbon dioxide back out to the mom, so the baby can live off the mom's respiratory system and nutrition systems while in vitro or while in utero. So the chorion side, being towards the mom, is not immune privileged, but there's a lot of stem cells there. So if you gather tissue from the chorionic side, there's going to be a possibility of consequence of immune reaction because the mom's immune cells are in that chorionic side. So to prevent this from happening, what people do who use chorionic stem cells is they'll put agents in there that will kill off the stem cells. So this is where it gets a little bit Wild West. So what we tend to use in our clinics is primarily amniotic tissue and cord blood. They're the things that we use in our clinic. We also do a little bit of PRP, and that's all fine, and I'll talk about that later. But what happens is this. The FDA steps in and says, well, we're going to regulate this industry. We're going to tell you whether it's safe or not. That's the FDA's job. Is this treatment safe or not? And are you marketing it in a way that is in violation? So that's where the Wild West part of this comes in. So let's talk about amniotic tissue. Amniotic tissue that is not containing any chorionic cells, they are live cells. You gather these cells in the tissue, and then you have to put it in extract the cells into a liquid form and without damaging them, and there's ways to do that. And then you have to freeze them. You have to cryo-freeze them, which means taking them down to a temperature of minus 80 degrees Celsius. That's pretty cold. When you freeze something like a cell, you can picture that as a little fluid-filled capsule. If you freeze a fluid-filled capsule, the fluid inside is going to expand and rupture the capsule and cause lysis. That's true. So they've discovered in cryo-freezing sperm cells 40 years ago that if they use some anti-freezing agents, almost like a antifreeze, they can preserve those cells, and then when they thaw them back out, they're viable again. And thousands of women have been impregnated by cryo-frozen sperm after it's been thawed out. So they know this process works. And the agent they use typically to do this is called DMSO, dimethyl sulfoxide. So dimethyl sulfoxide is a cryo-freezing agent, and it's used very sparingly. And what it does is it prevents that lysis of the cell when it's frozen. So when you thaw it back out, that cell can still be viable and live. You cannot do this to a human body because when the body's dead, you can't freeze it and bring it back. You can't take a live person and freeze it and bring it back. But an individual cell, you can do that, and that's been proven many times over with the use of impregnation with cryo-frozen sperm. So you use this DMSO in minute quantities, and it acts as an antifreeze. The guys or the companies that collect stem cells from the chorionic side, which is a bigger part of the placenta, have to treat those immune cells. So what they do most commonly is they'll use larger quantities of DMSO. It's the same ingredient that's in the amniotic cells, but it's in larger quantities. This is to kill off the mom's immune cells, which also kills off and makes the stem cells less viable. It might not kill all of them off, but it definitely decreases the amount. So the Wild West part of this is companies that were doing this were promoting the number of cells as the key factor, meaning, oh, our cells have more cells in it, or our product has more cells in it than that product, therefore ours is better. Well, it depends on viability. So the FDA started to get involved in this, and they said, all right, you have to be able to prove you have cells in there, and you have to do that by counting the cells. So when you take amniotic tissue, it's hard to count those cells without damaging them and staining them. You have to stain them, it's an 11-day process, and you have to be able to count the cells basically when they're a dead state. And you can say, okay, we can tell when we stain this cell was still alive, and so you can count them, but that batch is ruined. You can't use that batch on somebody. So the FDA has said that, well, if you can't count them, every individual vial, you can't claim that there's live cells in there because theoretically you don't actually know. Even though amniotic tissue has lots of stem cells in it, and if you collect it in the right way and they're alive, there's lots of cells in it. And when you take sample batches after they've been frozen and thaw them out and independently study those, and the company we work with, when they do this, they typically come up with a 93% viability rate. That means 93% of the cells are still alive after being thawed. That's in those, but you have to damage those samples to get that count. You cannot say, well, then that means all of the batch has that. Even though they consistently get that number, the FDA says, if you didn't count each individual vial, you have to put 0 count live cells. Okay, so we call it amniotic allograft. Allograft means other tissue. It's a transfer of other tissue from the amniotic tissue, and you're using that tissue as a graft in that patient. The theory behind it, nobody really actually knows exactly what happens because we don't have little cameras in the body watching what happens. But the theory is when they go in there, they somehow stimulate your body to either use its own stem cells or the stem cells that are put in there and go to work repairing the tissue. Clinically, what we see is when we inject this into a patient, we see them start to report dramatic improvements in joints that have been arthritic and were deemed for joint replacement. We do a lot of knees, a lot of hips, a lot of shoulders, a lot of heel spurs, a lot of fingers and wrists and different problems like that. And when we do this, we typically see the patients get tremendously better from a clinical viewpoint. When we test them, when we evaluate them, they're passing tests that they couldn't pass when they first came in. And they're reporting subjectively, hey, I can do things I haven't been able to do in 15 or 20 years, like run up and down stairs or play basketball with my grandkids. So we know that we're getting a result there. We don't actually know the exact mechanism because we don't have the technology to go in and see what's happening in those cells. So because of that, opponents of amniotic allograft will say, there's no cells in there. They're all dead, which is not exactly true. It means that there's been 0 counted. That's a very important point. If you can count them, you have to kill them. So there's 0 counted. So a lot of times people would be misled by the Wild West guys out there saying, well, their cells are all dead because look, it says 0 live count on the package. And people go, oh, therefore that must be true. You have to understand the law behind this. So the laws behind this also affect how much you manipulate the cells. So what the FDA has deemed that if you exceed what they call minimal manipulation, you're now making a drug. So if you use solvent in separating cells from fat, the FDA is now starting to consider, well, that's actually a drug, and that doesn't fall into a tissue transplant, and you don't have a, a pharmaceutical manufacturer's license, which is very difficult to get, very expensive to get, and lots of clinical trials and university backing and everything else. Not clinical trials, double-blind studies. So it eliminates a lot of the market and would make these stem cells very prohibitive. Because of that, you have this Wild West environment popping up saying we can do this, we can do that. There's a lot of people say, well, stem cells from your own body is the only one you won't react to. That's not necessarily true. Stem cells from your own body, we can count them because we're spinning them down and we can actually see them. So you can claim they're stem cells, therefore amniotic tissue are not stem cells. That's not 100% true. It's gray. But that's why I explain this to you, because the reaction rates we're getting to the stem cells from amniotic tissue are incredible. The same with cord blood, incredible. Things that I would have never believed I would see. The other nice thing about this is they're very safe. So I believe with amniotic tissue transfer, there has never been an adverse reaction to that injection that I know of. I know we haven't had any in our office. So when you're looking at the history of this, it is one of the safest procedures you could ever possibly get. It is safer than a cortisone injection. It is safer than just about, I mean, it's probably safer than aspirin. So you look at this type of treatment and it's tremendously beneficial. But now the FDA is coming in and saying to people who are using the adipose cells, you're exceeding that minimum manipulation rule and you're violating the law and you don't have a pharmaceutical manufacturer's license. And they even sent a letter out last year warning doctors who were doing this, you better make sure that you're not doing this because you can get in a lot of trouble for it. So that kind of took that one off the table. So then you look at the bone marrow, and that's a very viable way to do it. But the problem with that is I don't think I'd want to be the person volunteering to have that bone marrow extracted from my bone. Plus, there's potential for infection there. Even with the liposuction for the adipose cells, there's also potential for infection when you're opening up a bone to extract bone marrow from it. It's still a viable way to do it. It's just not the way I would personally do it if I was the patient. So then you look at amniotic and cord blood and those types of things. And that's what we've been doing in our clinics for those reasons. It's convenient for the patient. It's less invasive. It's less expensive. And it's got a tremendously high success rate. We have taken x-rays, particularly of my wife. I'll point this out. My wife, who has had chronic degenerative problems with her knees since she was 12 years old. She's now 55. And was getting to the point where she was starting to consider that she needs to do something about this, but did not want to do the surgery. The reason she did not want to do the surgery is she's a physical therapist. And she's seen a lot of effects of surgery when people had knee replacements and hip replacements. So she wanted to avoid that route at any cost. So she tried the stem cells a couple years ago, and after not being able to run on those knees for 30 years, or squat and sit crisscross style on the floor with our daughters as they were growing up, all of a sudden she can do those things. For the past 2 years, she actually runs. We have a treadmill upstairs, and because it's beautiful out there, but we've seen wolves and we've seen coyotes, and so she won't wear a gun when she's running, so I bought her a treadmill so she can run in a safe environment. But my wife now runs 3 and 4 days a week. She was not able to do that for over 30 years prior to getting these stem cell injections. We took post x-rays 8 months after she had the injections, so it's not fluid in there, it's something's in there, but there's a distinct difference in the spacing of her joints compared to when we first took her x-rays prior to the injection. So we see this over and over and over again. It's usually about 96% of the time we see improvements like this. If we look at the bigger picture, what would you rather do? Surgery, pain medication, or this type of treatment, which has virtually no side effects and a tremendously high success rate and relatively little cost. The cost is significant to the patient because it's not covered by any insurance. However, when you compare it to things like surgery or a pain management regimen, there's no comparison cost-wise. This is far cheaper. So regenerative medicine is the Wild West. There are lots of claims out there. There's companies that actually come in and say, oh, look, ours are a better form because it's powdered, and you just mix it with water and it comes back to life, and you don't have to freeze it. Well, I've heard somebody say, well, they're not sea monkeys, and that I wouldn't trust that type of product. There are companies that are putting chorionic into their amniotic and calling it amniotic because there's a rich source of stem cells there. You have to weed through all these companies to get companies that are safe and viable. We wanted to work with companies that had a direct line with the FDA and were compliant with the FDA and worked overtime to make sure their products were compliant with the FDA. So that's why we use those products. We have a tremendously high success rate. If you say, well, I did this other form and it worked, great, I'm glad you did that. To me, that's better than surgery or a heavy drug regime. What's a crime is that this regenerative market, which is really catching America because of its potential, is attracting different practitioners and different companies to be cutthroat instead of working together and realizing, hey, this is a very, very viable, optimistic way to treat people's health problems. And working together and doing that, We have people cutting each other's throat, attacking them, trying to ruin their business. For what? The real enemy, I think, is the people that are pushing the drug regimen. You know, I know a lot of surgeons, and they'll tell you, they do surgery as conservatively as possible because they know that that creates problems with the body. If you have your knees replaced, they have to cut off the top of the femur and the bottom of the femur and the top of the tibia to put this man-made surface on there so that you can use the knee again. And that's a great thing. It's helped people a lot of ways to be able to be mobile again and so forth. But because it's man-made, they don't last forever. And typically, you know, we hear different numbers. When I ask audiences, you know, how long do they last? First I say, how many of you had it? And a lot of people raise their hands because when we get people come in for stem cells for their right knee, it's because they've had their left knee replaced and they don't want to go through that again. So when I ask those people, they're saying 10 years max. Well, you talk to a surgeon, they'll say, well, 15 to 20, but the studies show it's more like 14 or 15. So let's say it's somewhere in that range. If you get a knee replacement in your 40s, when you're in your 60s, you're going to be facing some hard decisions because they can only do that 2 times. They cut too much of the bone away. So what do they do after that? Well, after that, now they're talking about options like pinning the knee or amputation of the leg. These are all options on the table, and that's not something I'd want to face. I'm 56, I'm heading into my 60s. I still feel young, I still feel energetic, I hike, I do a lot of things, I'm very active. I would not want to be facing in the next 10 years the possibility of pinning my knee or having it cut off because I opted to get a knee replacement 20 years earlier. This is why we do these things. We're giving people better options. It's a much better outcome for the patient. It's just a great thing. So I hope that we see some of the Wild West cowboys in regenerative medicine starting to change their viewpoint and starting to say we should actually promote this not as a gimmick, but as a future. You know, there is some hope of that. There's some doctors in Texas and Arkansas that got together with the Arkansas state legislature and the governor, and they educated them on what regenerative medicine is. So the state of Arkansas looked at this and said, for their own state employees, which when Arkansas opted out of Obamacare, they lost some federal dollars, so they had to come up with a way to offer benefits for their state employees. So what they did was they went to Blue Cross Blue Shield of Arkansas and bought a plan for all their state employees and dependents, which when you look at that number of people, it's about 500,000 people. And they took out a $100,000 deductible on each one. And the state pays the deductible. So they're looking for ways to conserve money. And they looked at their largest expenses, and chronic degenerative arthritis was up there, and the surgery for those things was very, very expensive. And I think in the hundreds of millions of dollars. So they got educated about these stem cells and the effects of it, and these doctors were very diligent in explaining this to them. And what happened was the state of Arkansas said, all right, we will cover stem cells for our state employees and the bracing and the rehab to correct the problem, which is all important. It's not just the injection that's going to fix you. It's the injection and the other medical services and physical medicine services that will help correct the problem. If you only inject the stem cells, whatever caused that to degenerate is going to cause degeneration again in the future. So the state of Arkansas said, we'll cover all those things because it'll save us millions, if not hundreds of millions of dollars in surgical costs. You know, you can't just take the cost of a procedure and say, oh, well, this will add this much burden to the healthcare system. You got to look at that and how it's going to affect the already expensive systems that are being used in that system. And if it reduces these tremendously and it has a better outcome at a lower rate, well, that's a definite good investment. That's what the state of Arkansas found, and that's what they actually put in as law. So that's encouraging to see that. Some large companies, I believe, are looking at the same thing, if not already adopted it. I believe, well, I don't want to say any companies because I don't want to speak for them, but there's some very large corporations in America that are looking for the same benefit for their employees or executives at least. And that's encouraging because you got people realizing dollars and cents wise, this makes a lot more sense. So I think that's a lot of the topic on regenerative medicine. I just wanted to cover as many of these ideas. You got to be aware when somebody's coming into you and trying to knock their competition. Oh, we have a lot more cells in our vials. It doesn't mean it's a better product. Or their cells are all dead. It doesn't mean that's actually true. They're taking scenarios in government regulation and marketing, and they're twisting that to their favor just to sell a product. You have to get a company that actually cares about the outcome of the patient. Just like we do as doctors, we have to care about the outcome of the patient before we bring in a service. You have to find a company that cares about the outcome of their patients and their reputation. They're looking for a long-term reputation and not just a flash in the pan and make quick money. So be very selective when you pick whatever stem cell source you use. And the last thing I'll touch on, we mentioned PRP, and PRP is where you're extracting your tissues and spinning them down to injecting them back in and trying to attract your own stem cells to the area. Again, that works. There's people that do it. But if you're older, it's going to be more difficult to get that to work because you have less stem cells and they're less viable. However, what we're finding is a lot of clinics are using this as a booster in conjunction with their stem cell injections and getting tremendous results with it, especially with more difficult cases. So I hope to shed some light on regenerative medicine. By default, I've learned a lot about this, not because I'm a really smart guy or a really learned guy, but just because I've worked with it and talked to so many different people in this industry, and I have to kind of piece together what's real, what's not real. And hopefully this gives you a good understanding of, basics of regenerative medicine and how not to be caught up in the sales hype by some of these cowboys that are out there trying to push only their agenda and criticize everyone else. It's a very small-minded way to do business. Those people usually don't last long, so let's hope they get weeded out of the business rather quickly. Thanks for listening.